the slides? Okay. Oh, okay. Okay, ladies and gentlemen, we are going to begin the first afternoon session today. And Dr. Morley, Dr. Farris, and myself will provide the three presentations followed by a Q&A. We're going to dive a little bit deeper into some of the clinical topics here that you'll see, and I'll turn it over to start with Dr. Morley.
Thanks, everybody. So this is I'm going to try and keep this light and keep this going quickly as in our post-lunch. Not always the most attractive time slot, but I think I can make it worth your while for sticking with me. So as I've mentioned over the last day or so, I work with the Nashville Predators in the National Hockey League. And so, part of my job among the physical, musculoskeletal space is also to take care of, illness and injury concomitantly. And so what athletes need to know is really part of my job and one of the things I focus on. I do have some industry relationships. None of them have any real meaningful effect on what I'm going to talk about today. Like Amanda earlier, I have to read the disclaimer that the views and opinions presented here are my own. They do not reflect those of the Nashville Predators, the NHL, the National Athletic Trainers Association, or the Professional Hockey Athletic Trainers Association. Because again, as I mentioned before, there's a lot of kind of different people coalescing into the group today. I do want to take just a minute to give a little bit of a shout out to the athletic trainers and just clarify, just from a nomenclature perspective, the term we refer to ourselves as athletic trainers or certified athletic trainers or sometimes ATs. The term trainer is really nondescript and not appropriate considering what we do as part of the healthcare delivery system. So I'm not a slide reader. I will read you this one, but I promise I won't read you any more slides. Athletic training encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, or chronic injuries and medical conditions. Athletic training is recognized by the AMA, the Health Resource Service Administration, and the Department of Health and Human Services as an allied healthcare profession. And so what that means, where the rubber meets the road, is that we're a bit of a center fielder. And so we're really kind of the first point of contact in, oftentimes certainly in the sports paradigm, high schools, colleges. We're the first point of contact in whether it's, injury or illness or any other, resulting pathology. We're the center fielder. It kind of starts with us. And then based on what we see and what we evaluate and what we ascertain to be going on, we can kind of either render services ourselves. Other times, obviously, we bring in other people to help render services with us. And so you might be thinking, well, it sounds kind of a lot like what nurses do, right? So nurses in the medical delivery system are also part of that first point of contact, oftentimes are the ones delivering care, and certainly are the ones who are seeing your patients repeatedly over and over and over again. So oftentimes it's the nurses, likewise with the athletic trainers. On their first physician exam visit, the patient might not be asking about CBD or cannabis. But when you spend time with the patient over and over and over again, and maybe the pathology is not improving or not improving the way that they would like it to, maybe they start asking more questions. And so like nurses, athletic trainers are the we're really the gatekeepers as part of the medical delivery system, largely specific to orthopedics and MSK problems, but it's really broadened over the last few years where we're really talking about certainly all sorts of different concurring pathologies. And so I was asked to talk about what athletes want to know and what do they need to know. And so I think that if we're going to talk a little bit about the differences between different kind of groups of athletes, and obviously a lot of it has to do with age and physical maturity and those sorts of things. If you notice at the high school level, not all athletic trainers, not all high schools have athletic trainers. We would love to change that, and we're gaining some traction there. But at the high school level, maybe there's one athletic trainer for 4, 5, 6, 800 student athletes. So the relationship and the intimacy of that relationship oftentimes is non-existent. There will be some of your kind of fan favorites who are in the athletic training room all the time, but really it's a service-related type of a role and of a relationship. And so oftentimes the people who are influencing them are parents, coaches, people that they see on TV. Now, when we flip that and go to the collegiate and pro environment, that list, notice it has a lot of the same people on it, but the list is in a different order. So the reason why is because I have a staff of 4 athletic trainers and 24 athletes. So that's about 1 to 6, right? So, the time that we can spend with them, well, not only do I see them oftentimes all day, every day for months and months and months at a time, but the amount of time that I can spend with them is much greater because I have a lot of time in order to render services, evaluate what they need, and kind of move forward. And so it's those conversations that often organically turn into, what are other treatments that are available, what are my friends using, and things like that. And so, so I just got done telling you that, but I haven't really spoken much at all about what athletes need to know and what's important to them. And so, I do this talk often, and I throw this slide up a lot, and a lot of people have seen this slide or some variation of it. And so this isn't a geography lesson. I'm not going to ask anybody to point to Arkansas, although Dr. Farris would probably be able to get it there first. What I do think is important is that let's just look at the maps just pictographically. So if I spend a lot of time in Canada, and I recently have done this for a hockey talk, so I kept Canada up here because it's relevant to at least one other person in the audience. And so, Canada's another country, and so they're going to have different laws and different legislation. And so why do we care? Well, we care because we might be going there. And so if you look at Canada, you don't have to be able to identify the provinces. I will say that, a lot of Canadians can tell us which state is which, and no Americans can tell us which province is which province. So that's something that maybe we need to work on in geography classes. Nonetheless, if we look at Canada, it doesn't matter that the shapes or the key is really small. What's important is that you see that they're different from province to province, right? So provinces are like states. They have their own provincial governments. They have their own provincial laws. So if we look at the different provinces, you notice that all the little shapes, obviously, one of them is medical use, one of them is recreational use, one of them is the ability to sell, one of them is the ability to grow. Well, they're different from province to province. Now let's look at the United States, which is, of course, a little more familiar to most of us. It's a lot of different colors there, right? So it's really, really important that athletes and the people advising athletes know the laws that pertain to them. And so Caitlin just left, but I was going to pick on Caitlin. And so the reason why I was going to do that was because Caitlin lives in Arizona. So everybody find Arizona. You don't have to shout it out. We're not going to point to it, but find Arizona because that's where Caitlin lives. Okay? Well, Caitlin told me yesterday that her family's from Wisconsin. So find Wisconsin and think about what color Wisconsin is. And now we're in Florida. So let's find Florida. And let's notice that Wisconsin, Arizona, and Florida are 3 different colors. I don't know what all the colors mean, but I live in Tennessee, and Tennessee's gray, and so I know that gray means there's no legal use of any kind. Well, I'm pretty sure that so is Wisconsin. So that means that if Caitlin, who has her TUE and her medical card and can use cannabis in Arizona, if she goes to see her family in Wisconsin and she's pulled over or whatever the case may be, Caitlin's in trouble. And now Caitlin's athletic career is in trouble. And Caitlin doesn't think that she did anything wrong. Many of us would agree that she didn't do anything wrong. It doesn't really matter. The state of Wisconsin would say otherwise. And so my point here is another one little game I play when I do some of these talks is I say, okay, everybody look at the state that you live in, and now look at all the states that touch the state that you live in. And if the state that you live in and all the states that touch it are all the same color, raise your hand. Okay, well, there's one person raises their hand. So that's the point, is that states are contiguous with other states, and most of the states and their neighbors, aren't the same color. And so that really, really matters from the pro sports environment and the collegiate sports environment. As you're traveling all over the SEC, there's all different colors, the Big Ten, and obviously these conferences keep getting bigger. I don't even know who's in what conference anymore. And as we mentioned, international law really matters too, right? And so we've mentioned this earlier. Certainly Russia presents its own challenges, and so what happened here isn't necessarily important for the purposes of this discussion, but what is important is that we understand that crossing the border from Niagara Falls, Ontario between Buffalo and Niagara Falls or St. Catharines, Ontario, if you're crossing over in Michigan or anywhere for that matter, professional athletes, collegiate athletes are doing this all the time. And so yes, this matters to us as a population of just normal people who may be using cannabis or cannabinoid products, but it matters a lot. The stakes are very high when we talk about athletes. Of course, this has been mentioned today as well. And so understanding your governing body regulations, there's a lot of rules you have to learn, right? Because if I live in Tennessee, maybe the city of Nashville Metro might have one specific set of regulations. The state of Tennessee may have, there's counties that may have specific regulations, and it moves on up, right? And then I haven't even talked about the sporting environments. And so I have to abide by Tennessee law and all the things that govern us there, but then I also have to consider what's happening at the NHL level. And every 4 years we have Olympics, and so then we have to think about what's happening at the IAHF, which is our governing body in hockey, as well as certainly, USADA and WADA. So the legal stuff is important, as I mentioned. Well, they also need to know what this is and what this does. And so, and I'm using this because this can be whatever you want. And in truth, this also means Celebrex. Like, people should understand what they're putting in their body, right? And so when people ask about cannabis and CBD, again, we don't have legal cannabis use in Tennessee, but even CBD and cannabinoids specifically, people say, well, what is this? Like, what does it do and why does it work? And so like our patients and like, your customers, if you're on the consumer side, different people want different amounts of information. And it's not about how smart they are or how educated they are. Certain people have more bandwidth because of where they come from academically. But big picture is that some people don't really care. They're like, I don't care what's in that pill. It makes me feel better. I'm taking it, right? And some people want to understand, what is this? And what is the capsule made of? Is this vegan? Is this non-GMO? And people have different questions. And so all that is relevant, and certainly from the perspective of the endocannabinoid system, that can be a really long conversation. I think it warrants mentioning that this works on something called your endocannabinoid system. And sometimes my explanation is that sentence, and sometimes it goes a little bit deeper. We'll talk a little bit about the difference between hemp and cannabis. I think it's important that athletes understand that. Oftentimes those words are used interchangeably, which of course they're not, but they can be used colloquially interchangeably, which is certainly a mistake and certainly something that people need to be educated about when the stakes are so high, where they have such significant governing bodies that they have to reconcile to. I think there's a lot of confusion, and I guess rightfully so, in the space of isolate versus broad spectrum versus full spectrum. And so, somebody will oftentimes show me a product and say, well, I took this and it didn't work. And so we have a conversation about a number of different things, and one of it is, well, this is an isolate product. And so there's this thing called the entourage effect, and this is why a full spectrum product might be a better choice for you. And I also think that we have to have realistic expectations, and we talk about this in the orthopedic community too, where if we go get an MRI on all the baseball players' shoulders, they're all going to have labral tears. So we need to have realistic expectations going into the MRI, knowing that that's what it's going to tell you. But what do we care about? We care about how this affects your performance, and if we're going to actually do anything about it, and if something's actionable. Likewise, with cannabinoid products specifically, when I started, I mentioned earlier, but when I started learning about this. I take CBD and it fixes everything. And I'm like, well, that's great. I would love to find one pill that fixed everything for me. Kudos to you. Most people aren't that lucky. And so what I would refrain from is you telling your friend over there, oh, take one CBD pill, it's going to magically fix everything. Because that's not really how it works. And so there is some difficulty, as I mentioned earlier, and I think some of our other panelists have shared, is that, and Martha was discussing the, start low and go slow. So you can't be all things to all people. It's not going to magically make everything go away. It might help you. And it might help you in some of these very commonly found conditions and in some of these very common, symptom profiles. But to let people believe, certainly to tell people, but even to let them believe, oh, this is going to magically fix everything, is really unfair, and is, and the likelihood that they continue using a product that might actually end up helping them is relatively low. People ask me all the time about nutritional supplements and cannabinoid products. Product selection is critical. And again, as I mentioned before, safety first, do no harm. And so the first thing I tell people is look at the COA. A certificate of analysis is you just like in this picture here, you take a picture of the barcode, it takes you to the COA. Now this is alphabet soup a little bit because I call it the CBC, like you get from your doctor's office when they take your blood, and it tells you if you're anemic and what your platelets are and all those things. It's the COA is the CBC for CBD. Right? So when we have our CBD, we want to know what's in it. So the same way when we look at your blood profile, it tells you what, if you're hypertensive and if you need some lipitor, right? So it's going to give you all this information. Well, that's what a COA does too. It's telling you what's in the product that you're taking. And I care about that because I want to make sure that you're taking something that's safe. Like forget about utility. Let's start with safety. Safety first. Do no harm. So it is important that we understand what a COA looks like. And I have this is a slide I just used. I was talking to a bunch of youth hockey players, and COA red flags are, does it have one? If it doesn't have a COA, I tell people not to take the product, period. You should feel shame. You probably paid $5 for it at like 7-Eleven or Twice Daily. Feel bad about yourself, put it away, call it a learning lesson, right? We've learned something today. So it has to have a COA. Certainly we look at the THC content, and again, we talked about the FedEx thing, and so there are certain places where having, more or less THC on board is going to be an issue. Certainly relative to the amount of impairment that you might face, the psychoactive effect is certainly relevant for people in terms of what they're trying to accomplish. And if the COA, again, as I kind of joked before with the brownies, like here, taste these, are really good. The same thing is very important to identify that the COA came from a third-party lab. If I make a COA for my own product, I don't think that's terribly trustworthy. I do, because it's my job, I do mention, especially when people are talking about the use of cannabis, I mention that there is something called cannabis hyperemesis syndrome. In Tennessee, where there is no legal cannabis use, and we're talking largely about cannabinoids, that's not really an issue. When people are talking about the use of cannabis hyperemesis syndrome is a thing, it does exist, and I explain to them that this is out there, and they'll let you know it comes from, largely long-term and heavy use. And so not a major concern typically in the space of athletics, but certainly something that we address. And so why, if you're out there and you're a manufacturer, you're on the commercial side, why do you care what athletes know and what they don't know? Well, you care because they have a platform and people listen to them and they watch what they do. And so sometimes athletes make really bad decisions and people follow them, and sometimes athletes make really good decisions and people follow them. So Charles Barkley, of course, famously said, "I'm not a role model." It's not necessarily how it works. Like I said, they have a platform. And so, just like Martha Stewart and Snoop Dogg have a platform and gain some notoriety in this space, athletes do too. And so Megan Rapinoe from the women's soccer national team, her twin sister Rachel, they founded this company called Mendy. Paul Bissonnette, who people know from both being a retired NHL player and also from his podcast Spit and Chicklets, he's partnered with Canna Brands. I know we're in Florida, we have to talk about Gronk and CBD Medic. But I mean, athletes representing brands isn't new. So we wanted to be like Mike 30 years ago. And so from a marketing and like brand awareness perspective, we've been talking about this for a long time. And so that's why this matters to you. And so programs and products have identified the role of sports medicine physicians, athletic trainers, physical therapists in sports. And so here's one where Shaq, who reps Icy Hot and Icy Hot products, they did an Instagram. Now it was during COVID where everyone was trying to really find their way to market whatever they could market. And so he got on with Tori Lindley, who at the time was the president of the National Athletic Trainers Association, and they broke the internet. They had so many people they didn't know what to do, where they did this really cool Instagram Live where Shaq talked about, this is how I feel. Tori, how do you think as an athletic trainer this can be used in the sports setting? And it went really well. It was really cool. And so, other programs or other companies rather in the athletic space are doing this as well, right? This isn't new. So Hyperice, which is a company that make the Hypervolt, which is one of those like gun massage things, and don't buy it at TJ Maxx because it's not the same and it's not going to work. So if you're going to get one, you need to spend a little bit of money on it. So Hyperice, who have kind of absorbed the company Normatec, which is one of the compression companies that make the big boots with the intermittent compression. They've got a whole host of, certainly you see the folks here who are notable, the different athletes that are kind of representing them and speaking on behalf of their products and what they do. It's a really long, I couldn't make the picture small enough, but John Morant and Amanda Nunez from MMA, Christian McCaffrey, Robin Arzon from Peloton, Kelly Slater, the surfer, Tony Fino. So there's a lot of people who are out there already talking about different products from a therapeutic perspective, from a recovery perspective, from a wellness perspective. And so, I tell people these aren't just, cannabinoids specifically these aren't necessarily just sports products, right? Like we approach it really more from a wellness perspective as opposed to just this is a sports medicine product. And so kind of as I finish up, again, just kind of tying it back to what I was asked to talk about, which is what athletes need to know, why is this relevant to you or to us as an industry? Well, as I mentioned, they have a platform. And so, them talking about cannabinoids or cannabis, whether it's your product or not, can boost visibility, it can boost sales, it can boost revenue. And so what they do trickles down into mainstream activities, right? Because athletes are also people. And so that athlete, and this happens all the time, where an athlete will, one of our players will say, hey, that whatever you gave me, the Hyperwool as an example, the massage gun, my wife just had a baby, her legs hurt, her back hurts, I'd like to buy one because I want to use it on her. I'm like, okay, cool, here's the rep, call him. And so, so there is a platform, there is visibility, and their opinion does matter because people follow what they do. Obviously, like in all professions, there are some bad actors out there, both people and products, and we have no choice but to continue to educate has been one of our buzzwords, I suppose, and disseminate information relative to staying away from the products that aren't going to provide you any meaningful utility. And so nothing is without risk, and so we've talked a little bit about impairment and performance decrements, and so more specific to the cannabis side is that you need to understand, or patients or users need to understand how the use of cannabis affects them. I can't predict it. Everybody's different. Your endocannabinoid tone is different. Your metabolism is different. Whatever else you have on board is different. Your comorbidities. All those things are different. And then it all goes into the puzzle. And as you work with your physician, your athletic trainer, your physical therapist, whoever is helping kind of guide you along this path, it's really, really useful. It's important to understand that. Similarly to having, a glass of red wine is, is cardioprotective. Well, that sounds great to me. I'm going to drink all the red wine I can find. Well, that's not without risk either, right? So I think it's important to identify, as, I've kind of mentioned a few times now, that they're, finding the right way to use these products is really, really critical. So, we've mentioned the research thing as well. Whether it's industry supporting research, the research is really beneficial to provide us an opportunity to bring this information back to regulating bodies, USADA, WADA, FDA, whatever that may be. So I think that as I close, that's what athletes need to know. Athletes need to know how to pick a safe product. Athletes need to know how this is going to affect them, if it's going to help them. And at times, there are times, and certainly on the cannabis side, where it might hurt them, and it might be the wrong choice or it might be the wrong timing. And so there's a lot of, there's so many more questions relative to, obviously dosage, start low and go slow, in terms of the different routes of administration. Well, I want to take a gel cap and I want to feel better in 5 minutes. Okay, well, that's not how it works. There's this thing called first pass metabolism, and so that's not how, if that's what you want, then a gel cap is the wrong choice for you. And so it's an educational environment and an educational process that, we work with athletes and with normal people. And so I think that that's kind of how I would frame this discussion relative to what athletes need to know is, it's our job, it's my job personally, but I think from an industrial perspective, from an industry perspective, educating the athletes can have some downstream effects on educating the patients and educating your end users. And I think we'll take questions at that.
Yeah,
Right?
yeah.
Okay.
All right, hello again, and thank you for coming back. Again, I'm Jim Farris. I'm number one, a physical therapist, and currently moving back into education. I've been out of it for a year and a half doing some consulting work and part-time teaching and such, and we'll be back at Arkansas State in mid-August, and looking forward to it. I started that program over 27 years ago, the physical therapy program there, and coming back to it. How I got into this, I mentioned a little bit earlier, Jeff and I were really sitting around at a conference. It might have been here about 4 or 5 years ago, and we started talking about this, and he invited me to be part of the organization that he was forming, PhD 420, so I should probably disclose that. I am the Director of Curriculum and Education for that organization as well. And so Jeff asked me to present on what does the evidence tell us and about performance and recovery. And to me, with my background, the evidence is what's in the literature. What's in the peer-reviewed literature, what does it tell us? And I'll get into that as we go through this. So I spent quite a bit of time, like they were mentioning, you get 24,000 hits minimum if you just type in cannabis. And so how do you go from 24,000 down to the number of articles that I went through and presented today? Take a little bit of time and some fairly good discernment in a couple of areas. So here we go. What I want to do is focus on the literature, and some of the things I'm going to present, you might want to discuss it afterwards with me. But and I'm going to try and stick to that and keep opinion out of it if I can. And look at, what does the literature say? Do cannabinoids have a positive effect on performance or not? All right, so approaching it from kind of a neutral territory going into it and just asking that question. And then, kind of like what Dr. Morley was talking, why what do athletes want to know? Well, as I was looking through the literature, it's like I started to ask myself, well, why do athletes even use it? What are the reasons that they give for using it? There's a number of very nice studies. And all of this, I have all these references, and I think you guys got all access to the presentations too, so feel free to use it as you go. But some of the stress of competition, the stress of prepping every day, the pressures to perform, limited social support especially in the college and pro and minor league types of areas, limited social support there. The group dynamics of the team seem to have a play into it, whether the athletes are using cannabis or not. Team sports, especially. The injuries and physical pain seem to be other reason that athletes bring out in this. And an interesting note was retirement from professional sports. So they go from a life of a professional athlete into that of a civilian, if you will, and it's different. And so what are they using cannabis for in that life? And then they also said, well, we just use it for euphoria and to relax. And so no different than other things, but some things that athletes are saying related to that. The top study that I present there, this is mainly endurance-type athletes. They use it for pain, and they noted in their categories of athletes and athletic use, again, survey studies, okay, self-report survey studies, so you take that with a grain of salt as you read. The THC-CBD combos gave them greater benefits than did CBD or THC alone. All right, and so, and an interesting fact in a number of studies, not just these two, these are kind of exemplars of the studies that were read. Athletes choose to use this despite the evidence that THC does interfere with their psychomotor skills and cognitive function. Okay, we can talk a little bit about that later too. And then I had a category of articles, or now where's some promise? Where's some promise for some future research? What should we be looking at? And how, might we move forward and get through that, like I said, that thick glass wall that of research that we can or really can't do. And you've heard a lot about the WADA and removing CBD from their banned substance list. And like the presenter said earlier, it's complex. Not only just in America and in Canada are there differences, but throughout the different countries of the world. I mean, you've got countries that it's still illegal to have any cannabis product with you or on you. And we're talking significant jail time. And so you can kind of see those listed there. Russia being the one most currently in the news, but you have countries throughout Europe, throughout the African nations, and the Middle Eastern nations are almost in shutdown of allowing it to be used, if you will. There are really only a few studies on exercise and cannabis, and those studies focus on the THC or the delta-9 tetrahydrocannabinol. CBD, as you all know, is not intoxicating, but it has very significant pharmacological properties that if you go back to the patent that the United States had on cannabis, which expired in 1993, there's over 100 studies in that patent that show positive health benefit effects for CBD. And yet it's still Schedule I. The main properties we're looking at, anti-inflammatory. Can we control inflammation? Can we control pain with the analgesia? Can we reduce stress and anxiety with the anxiolytic effects of it? There's a strong neuroprotective indications, and there's some fairly moderate indications for the sleep-wake cycle influence, some positive, some negative there, by the way. The issue with these studies, and as I read through just multiple so-called systematic and scoping and narrative reviews, the studies that they're referencing are all preclinical animal study models, not translatable necessarily into the human, and definitely not into the elite human athletes. So again, there's some preliminary evidence that shows that there might be some areas that we can look at in humans and in sports. But again, keep in mind that it's not yet been translated into the human condition necessarily. Okay, now, moving directly to cannabis's effect on performance. And there's a very few studies, and I tried to limit the investigation into the literature to 5 years back. And I had to go a little bit deeper than that to actually find some of the studies that were done earlier. And in most of the reviews, they talk about 6 studies. I started reading these reviews, and I'm like, wait a minute, I've read this before. They're all reviewing the same 6 studies, and yet they're publishing these systematic reviews. We don't need any more systematic reviews on cannabis and performance. We need real studies. And so the 3 studies that are commonly referred to, they use subjects that had pathologies. In one of the studies, the subject had cardiovascular disease. In the other study, they had COPD. Okay, these subjects in these studies were not capable of maintaining any type of workload or doing any type of exercise at any level that even a non-athletic, sedentary human could do, in that 5 to 10% range. And yet they refer to these studies and show and say that there's a reduction in performance. Okay, well, I don't put a lot of weight on that right there, okay, because it's not necessarily in the athletic realm or these types of things. A few older studies coming out of 2 Canadian universities. Now, the cannabis that they used was what I would call kind of old school from like the 60s. It only had like 1.4 and 1.7% THC. And it was interesting to read on how they actually smoked the product and then the precision that they made them smoke the product and the grams of the product and everything else. Kind of neat there. But the problem with the first study is that they use what's called physical working capacity 170. And so it's their working capacity at a heart rate of 170 on a cycle ergometer. Well, the cannabis group had an elevated heart rate after smoking. All right, elevated heart rate, elevated blood pressure after smoking. That automatically skews that physical working capacity 170 result because it's directly related to a linear increase in heart rate, and they hit that 170 at a lower intensity than they did when they didn't smoke. So I can't say that performance was decreased and not or there because the data is skewed. In the other study, there was no difference in VO2 max, a similar type of protocol to the first one there, and they similar in cycling and everything, but they did progressive incremental to maximum oxygen consumption, and they saw similar things that the first study did at submaximal workloads, but then taking it when they get above 80%, there was no difference in performance, physiology, or any of those other things with the individuals who smoked cannabis. All right, and so, from this, it's very hard to say what the effects of cannabis on performance are because there are few studies and they're not done very well, to tell you the truth. And then a lot of the studies also look at just physiological responses and not necessarily athletic performance or sports performance. And if you look at these two that I have here, and I kind of went through my presentation, just highlighted the CBD just to show that, these were CBD isolates, not necessarily full spectrum or anything like that. And so they're looking at these types of things. The Crossland article, and there's 2 other articles very similar to this. There was really no difference between the CBD group and the other groups when they performed strength training exercises to fatigue. Some of them are eccentric, trying to create muscle damage. Now, Crossland, I brought this in here because they carried it out to 72 hours. And folks who study exercise-induced muscle damage and these types of things know that it kind of peaks somewhere between 48 and 72 hours. Well, the other groups didn't take it out to 72. Crossland did. They didn't see any difference immediately after at 24 and 48, but at 72, they did show decreased inflammation markers and increased torque in the female athletes. So possibility that it takes a little bit of time after these types of high intensity types of exercise for there to be any type of physiological difference between those who have taken a single dose and those who have not. And that's the other thing. These were single doses. Okay, not talking about chronic use or repeated use. And that was in the Eisman article that I kind of combined the two there. Sorry about that. But again, single doses and different dosing. One was just a standard 60 milligram dose, and the other one was based on milligrams per kilogram body weight, which you'll see quite a bit in the animal studies, which, how many of you have ever taken a 400 milligram dose of CBD in one shot? Okay, we got one, yay. So 1% of the registered people here have maxed out on their CBD. But some of the animal studies, they give them such a large dose, translating that into a human dose is not necessarily practical. I mean, even just trying to buy 408 milligrams of CBD is kind of expensive right now, to tell you the truth. All right, so again, keep in mind what's available out there and versus what you're hearing in the anecdotal world. It's almost completely different. Now, that was performance, and this is recovery. Again, not a whole lot of evidence on THC in recovery, but in muscle damage and pain, there's in rugby, the one down the bottom, I want to go with that one first because it has an interesting point. About 80% of those that reported using it, which is about a third of the rugby players that they investigated, about 80% of them are using it for pain. Yet only 14% of them says it improves their pain. So again, that takes us back to who is this effective for and who is it actually working for? What kind of pain do they have? What are their injuries? They didn't go into any of that. So it kind of leaves it, wide open. Again, a survey study, self-report, kind of going from there. The exercise-induced muscle damage, talking about the Eisman study there at top, they had, again, no difference at 24 and 48, but again, that 72-hour time frame, small, very small, but yet significant differences there, okay? Let's see. For the pain one, when I was looking at pain, and I did one just purely on pain, and there's quite a bit out there, but most of the evidence on reduced pain is in clinical populations with pathologies and clinical types of diseases, and not necessarily well done in the athletic population. So that area is wide open right there. Sleep, anecdotally, used for sleep, improve sleeps, help them sleep more. There was even one article that some of these reviewers referred to that says that sleep quality is improved. They sleep deeper and they feel better when they get up. So I went and got that article. There's no data in that article. It was an opinion paper. And the fellow that wrote it has no references. And yet it's being cited in multiple review studies coming out now. I'm like, stop. Who are the editors for this journal? Who's reviewing this stuff? And so, anyway, be careful what you read. It's not always true, even in peer-reviewed studies. There are possibly some disturbances with THC and long-term CBD use, where sleep is actually disturbed in some people. There is a benefit for some that are having sleep difficulties, especially those with insomnia or anxiety-related lack of sleep. There's some benefits there. And I called them out there too in that bullet. That's the article that, anyway, I won't go there. And then, again, going back to the rugby player one, the 41% of them said that they were using it to improve their sleep. And this is 55 out of 133 players that reported using it, but they didn't tell, did it improve their sleep or not. It just said that's what they were using it for. So really well-designed sleep studies, of which there might be one that's fairly well-designed as far as sleep goes in the normal population, but the others, they're not well-designed from a sleep research point of view. So again, another wide-open area for recovery. And sleep's important for recovery. I think sleep is often overlooked from a recovery point of view, but nobody really ever got stronger while they were working out. Okay. Improvements come when you get to recover and rest. So, just a warning there, and I think Dr. Morley started to point some of that out there with the certificate of analyses. There's really not a good regulation on over-the-counter products right now. And a number of studies, 3 that I can think of right off the top of my head, and most of them have the same thing. 30% of the CBD products that are available on the market have THC and other cannabinoids that could result in a positive drug test or a violation of the anti-doping rule. And, so it's like, playing Russian roulette if you're an athlete, with CBD products, unless you get really high quality with good analysis. And the legality of CBD is still complex, illegal in many countries, and throughout the United States, it varies where in the states that you go. Okay, and I think I'll just keep going here. I'll try to stay out of that. So, We really need some well-designed studies on cannabis in sports, much needed. They're lacking. There are few, if any, hardly at all. Athletes use cannabis for a number of reasons, all right? And I'm not trying to invalidate any of those reasons, but they don't really have scientific support in the literature, right? So we have a lot of anecdotal types of uses and improvement going on here. THC, very commonly reported to be ergolytic, almost prevalent in the literature. THC physiologically and performance-wise decreases balance, decreases reaction time, decreases cognitive functioning, all these different types of things. And so when Dr. Konin's talking to his athletes and saying, hey, think about it. You know, if you're going to use, think about what it does to you. And if it decreases your performance by 10%, do you want to be only 90% when you're out there competing? You know, and in most elite sports, the winner is less than 1% ahead of the first loser, right? And so 10% can make a big difference there. CBD does have some potential areas for investigation that I would really love to be seen pursued. And just from looking at the literature, the THC-CBD combo seems to be even more effective than CBD or THC alone. And this is an opinion, and so I got to put it straight out. I think the market right now is not right. The market is, how high THC product can we make? And that's what they're selling to people. When CBD is indicated for their condition and can be beneficial for their condition, and they're not getting it in the product they're buying. And so, you know, I advocate for a more balanced THC CBD product, right? Okay. Until we get cannabis removed from the Schedule I status, I think it's going to be difficult to find the rigor of studies that we need. So that's why I talked about that catch-22 with Dr. Rosenthal and Josiah. You know, how do we get around it? And so I think some creative researchers, like the lady in Colorado, is what we're going to need to start to provide the evidence to do this. And then just understanding the legality is still, it's hard to get by. It's hard to get by. Let's see, next is, well, a whole bunch of references that I'm not going to bore you with, just let you know that they're there. And you can also get them in the presentation if you want to go back and read them. And I thank you for listening to me. And just know that that's what the literature said as I went through it, all right?
All right, thank you, Dr. Farris. How's everybody doing? This is the hardest session when it's right after lunch. So my presentation is on concussion, and I want to start by saying that, I don't know if you're aware of this, to my knowledge, and if I'm wrong, let me know, sport concussion is the only medical condition that's legislated and directs a pathway of intervention of things that we as practitioners have to do. In other words, there are conditions written into cannabis laws, but they don't say if you have this condition, you have to or don't have to do X, Y, and Z. We have laws like this regarding sport concussion that dictate how we can intervene prior to how long of a time frame we can return to somebody back to their participation status and many things. And each state is different because their state law is not federal law. So just to begin with, this is an area that is of interest to me, and it's really of interest to me because it's what I call my story. Okay, so these are my disclosures, but the part that's most interesting to me is how I got to this point of my story, and it all revolves around concussion and what led to our development of my interest in this area and what we have called the Global Initiative for Cannabinoid Research and Education at our university. So I was traveling around on a roadshow teaching sport concussion in 3-day workshops. And it happened to be out west, and there was a physical therapist in the audience. And he said, I have a question for you. I know when patients make their first appointment to see me, if it's a concussion and I know how to prepare for the initial visit, should I contact this person ahead of time and just ask them not to put any marijuana in their system, not smoke right away, so that I can do a fair baseline evaluation? I want to test their memory, I want to test their vision, their anxiety levels, their balance. And he said, do you think it's a good choice to ask them to come in under normal, neutral circumstance? And I said, well, yeah, that actually sounds like a really good idea. I might add it to a slide in my next roadshow and tell people, here's a good idea, I think what you should think about. But then he said, well, what about that same patient 10 days later, and I'm treating them, but they're not getting better, and they have migraines, and they have anxiety, and they have difficulty falling asleep. Should I tell them to go back to using or to start trying a little bit of low-dose marijuana and see if that helps my symptoms? And I had no idea. And at the time, I, A, didn't know what to answer, and B, didn't know if I was even legally allowed to answer and make such a recommendation. And so that led me down this pathway, saying, okay, you know what, just talking about sport concussions is boring to me, it's a thing of the past. I'm going to start learning more about this. Because how many times have you heard people say, cannabis, it's coming? Have you heard this? It's coming, it's coming. In the circles that we walk in sports world and healthcare, people say it's coming. Folks, it's here. You know it's here. We know it's here. But a lot of folks haven't figured it out yet because they haven't realized how to embrace what's happening in society and with their patients. What I looked at very quickly at the time, I think we were in the low 30s and maybe about 11 states with legalization of medicinal and adult use. And I said, well, that's, in our world, that's over half the states that have some system. And I just come from a state that doesn't have to deal with this as much, and so I'm really unaware. But many of you are aware, and you have to address this. So that led us to starting an initiative for me to learn, for me to study, for me to educate, grab a couple of others, join on board in our areas, as Kevin talked about, within athletic training, physical therapy, and I work with in gym, and then all of sports medicine at many of the medical meetings, and now international. So we started this group, and you can see what our vision and our mission is. And if any of you out there want to partner with us in any way, shape, or form, we're always all ears. I don't know if there's a way. Sometimes we might stretch a relationship, but the goal is to spread the word and to collaborate and work together. So I want to talk about right now, for those of you that may be familiar slightly with or not at all, what we typically call a best practice. How do we handle a sport concussion? And then talk about evidence relative to any cannabinoids on symptoms that are affiliated with sport concussion, and then see if there's actually a connection. So a disclaimer is that this majority of what I'm going to present to you is essentially theoretical. It's certainly not the standard of care right now to use cannabinoids either prior to or after a concussion. But there is a lot of theory that holds its weight. And so this is my story. So when we have individuals with concussions, things that we do in our evaluations throughout the process is we look at psychomotor skills. How do they move? What's the quality of their movement? What's the reaction time, the speed of their movement? We look at eye movement. There are connections from the eyes to the brain and vice versa. And we do a lot of tasks that check their neurocognitive function. So for example, the picture on the right is an image of a software program where we would test somebody's memory and show them, in this case, images that you see, and then ask them later, pull up the same slides or slightly different ones, and test their recall. We might ask them words to remember. We might ask them to do some calculations. We do lots of different things to check their neurocognitive status. We have typically, and this changes very frequently, but we typically define a concussion into 6 what we call trajectories, meaning these are the main areas that we would target to treat with their symptoms. It's rare an individual person has all 6 of these. It's not uncommon they have 1. Most commonly you'll see 2 or 3. So do they have migraines that are sticking around? Do they have the anxiety that we talked about that perhaps wasn't there prior to this concussion? Vestibular, meaning their balance. How is their balance with their eyes closed on different surfaces? Because we're talking about different athletes. One person might need to perform on clay. One might need to perform on ice. Lots of different circumstances, and some don't perform on the ground at all. So what's their general balance when we're working with them? And we would assume we're working with athletes, so their balance would be at a high level to even begin with. Many individuals, by the nature of the thrust to the head, the force to the head, are going to end up with different type of cervical issues, neck muscular problems for the most part. And then they have visual tracking mechanisms. So I find it interesting because we were talking before about the ability, I know Caitlin was mentioning that when you do something over and over and over and over again, that it doesn't really matter if I put marijuana in my system, I know this movement. But what we see are, even the smallest of concussions, and for the record, you'll hear people say I got a minor concussion. There's really no such thing as a minor concussion. A concussion is an injury to your brain. And so the number of symptoms might make it be more severe versus less severe, but they're all pretty severe. And so we'll see individuals whose ocular motor abilities change significantly following a concussion with minimal symptoms. And I've seen similar things happen relative to the intake of marijuana. So when you put these together, one of the things I talk to the athletes about a lot, and the literature may not show it, and some people may not want to admit it, but we see it, and the data of the on the ground, on the field testing shows it, that their motor tasks change. Their reaction time changes. And one of the things that I explained to them relative to this is, while this is an interesting situation, you might say, well, the THC is helping with my migraine. It might actually help one of the symptoms and impair a different one. So it's not an all or none. We've talked so far in this conference about does it hinder it or does it not. This is the same condition, but if you look at the 6 different areas, you might receive a benefit from one, but an impairment in another one by trying to treat the same condition with the same drug. And then there's similar things with both cognitive and physical fatigue. Cognitive fatigue, an example of that is that as I'm getting tired, or as I may have THC in my system potentially, by the end of the game, the 4th quarter, the 5th match, when I'm the most tired, I'm having a harder time remembering certain things. It might be a play I'm supposed to do. It might be who I'm supposed to cover on defense. There are lots of different things that come in. So if you think about tying these together, right, if I'm starting to get cognitively fatigued and I'm thinking a little slower, now when the play happens, if I'm on defense, that person has gotten by me or done something already, because by the time I figured out what they're supposed to do, they've already done it. These are real things that we do see post-concussion. These are also some symptoms that we see with THC in athletes. And so when you break those 6 trajectories down, these are things that I've talked about. You're familiar with much of this in general, but it's multifaceted. So if someone asked you the simple black and white question, can any form of cannabis, whether it's CBD, THC, combinations, be used to treat concussion, you would have to answer yes or no to all of these. And hopefully you can see then that this isn't today, and arguably it may not ever be an answer that you can say unequivocally yes or no. There may be some areas where we find some benefit towards one symptom and not so much towards the other, and potentially even impairment. So what do we see when an individual actually sustains a concussion? It could be because they got hit in the head. It's not always a hit in the head. So think about it. Individuals in a car crash that have that so-called whiplash, by the nature of that sheer force, they can induce a concussion on themselves as well. But it's some kind of rapid onset, fast movement that's short-lived, right? It's a one-time episode. Hopefully that's it, unless you're in a boxing match, at which point you can have continuous blows that can lead up to the concussion itself as well. But individuals will undergo what we call neuropathological changes, and those changes are reflected in their behaviors, in their thinking behaviors, in their movement behaviors, in their memory behaviors, et cetera, and I'll show you a number of these other symptoms. So this is a little bit of a busy slide. But what I want to point out to you is this is what we call a concussion symptomatic checklist. There are 22 things here that we measure each time someone has a concussion. And as we're treating them and we want them to improve, we measure these 22 to see how they're progressing or not progressing in some cases. And what I pointed out here with the red arrows are 7 conditions that we measure with post-concussion. And there's 7 conditions, arguably, that you've heard people talk about that can improve with cannabis. And so, as you can see, theoretically, a third of all the symptoms, and you could argue maybe even a few others that I didn't note on there, but there's certainly promise down the road that we can use a form of cannabis as a treatment for a concussion at some point. Again, so long as we're not improving one symptom, we're impairing another one at the same time. And as we look at these domains, understand they can also occur in a number of different ways. We do see behavioral changes, and we try our best to measure something called irritability. It's not necessarily that easy, but in the sports world, you can compare that to perhaps some other conditions in the general population. And we see a lot of things that just aren't very, very clear to us. But these are the physical signs. The one that we measure a lot is amnesia. That's why that physical therapist asked me about if I want to ask them recall questions. Should I make sure that I'm only measuring the concussion and not the concussion in any combination with THC that was acutely smoked? And you see sleep also is one that's on there that's of concern to us as well. So when we have a concussion and that shear force movement, what happens at a cellular level are the areas that cover the nerves and the nerves themselves become stretched, if you will, for lack of better terms, and that stretching slows down the message of what's supposed to happen throughout your body, okay? This is a neural issue. Now, why I bring this up is, if you heard Jim say earlier, the first patent that was out there that looked at CBD, identified by the federal government, was as a neuroprotective agent. So if you put the combination together, you could ask yourself two questions right from the beginning. If it's a neuroprotective agent and the main shear force that occurs is to the nerves relative to concussion, can we use CBD afterwards to treat the concussion? Others have even argued, why shouldn't we take CBD prophylactically? Will that do anything to strengthen the sheath, minimize the stretch if you actually have a shear force applied to you? I don't have the answer, and you might not, but it's something to think about down the road, because this is how you tie together and make research studies. Somebody asks the question, and then you go test it, and then you find out if it's true or not. And so these are the kinds of things that we do just to show you the different tests of asking them about memory, asking them about their symptoms, asking them to name numbers forward and backwards and do calculations, and say the name of the 12 months backwards. And I want to show you just how skewed this is right now, right? So let's do this together. I'm assuming nobody in here has a concussion. I can't assume you don't have THC in your system at this conference, but say it out loud with me now, and let's do it fairly fast, the 12 months backward. Ready? Go. December, November, October. Faster. Okay, good. We have a smart group here, so that wasn't too bad. But you can see that if you have some individuals just can't do that naturally, and then they joke and laugh, but you don't know if they really have an issue from the concussion, or they just messed up saying them backwards. So even the tests we have to measure concussions aren't foolproof in an average population that doesn't have a concussion. But these are similar tests that we would also use in a clinical setting if we wanted to understand. We're working with an athlete. Somebody can walk right up to you, have a conversation. You can smell the marijuana all over them. If you want to actually talk to them and test them, you can do certain things like this, and you'll see them struggle with some of these neurocognitive behaviors with the TH in your system. So you're going to hear a bunch of athletes say, no, this makes me more alert. I know exactly what I'm doing. I'm still doing it. And I will sit here and tell you with an N of one and another one and another one and another one and another one to that person. Neurocognitively, they will struggle. The more acute the THC is or the chronic it is over a period of time, they will struggle remembering playbooks, patterns, movements, and things like that. And those are career-ending type situations. What happens is, though, they'll argue with you because I've been doing this since I was 14. They're so naturally athletically talented that they could probably smoke on the field during a play in high school and still do well. But each time they come to a different level and they get to a higher level at the areas that we work with, you heard Jim say, the difference in events is 1% of whatever it is. I would argue it's like less than 0.1% in sports like swimming and some other things, and even running. And so, in Kevin's sport, the difference between nanoseconds of getting out of the way to avoid a hit to the boards or a concussion or serious injury, at those levels, the higher the levels, the less room for margin of error. We even have developed, so I mentioned this earlier, we have rules about how soon you can go back from a concussion. And even these rules, they're theoretically a lot anecdotal. We just, rules are made in what we do by athletes cheating. Okay, let me say that again. As we sit up here and say we need the evidence, a lot of what happens in return to play after an injury is based on an athlete not following our guidelines. So if they had an injury or let's say a surgery, and we say, okay, you're going to be held out for 6 weeks. And say, why 6 weeks? And we say, well, because that's how long it takes to get your strength back and the swelling to go down, your range of motion to come back, and that's when the tissue heals and it's safe. And then what happens? There's always somebody that cheats. And then through that, we find out there were more than one person that cheated, and now we realize it doesn't take 6 weeks. Everyone's cheating by week 5 because they feel great. And then we say, you know what, hey, we've gotten really smart in medicine. Now we need to change our protocols and advance them. We're going to now say we can get you better in 5 weeks. Most of what we learn is from the athletes, quite frankly, and this shouldn't be any different. We were all taught in school when we went from medicine or healthcare to listen to your patients. And this is one area we were struggling to listen to our patients. So we do a lot of field tests. It's also important to understand, like everyone was talking about so far, the studies so far don't have great methodology. They weren't using athletes. So even if the studies were designed fairly well, they were designed with a completely different population of individuals than our interest is in. So for example, if Kevin's going to test somebody and see what's their status with a concussion, or what's their status with a concussion in using CBD or THC down the road if Nashville got really brave with something seriously changed in the NHL. But you want to do things in their natural environment and test them too. And oftentimes what happens is we see them in an office-based setting and we have these conversations whether this could help you with whether or not, but our setting is not an office, it's the field, it's the ice, it's the pool, it's wherever it is. And so it's really, really important to understand if they just tell you on the field, I took this gummy and it feels really better, you have an awesome product. Can you apply that? Can it be translational, not just from the animal to the human being, but the human being to the athlete in their field of play? That's what's really most important for us. We even have various charts. Everyone has a chart to measure what are the most important symptoms and what are the key things that we want to worry about with their concussions per se. We even have developed these return to classroom rules that we give them. Think about why. If they have a migraine, they won't be able to focus in the class. If they have sensitivity to the light, they're not going to be able to look up. And so you know what we do? We say, okay, when you go back into the classroom, we want you to wear a hat so the light doesn't bother you. And then they go into the classroom with a hat, and what does the teacher say? This person's being disrespectful, take your hat off or you have to leave class. And sometimes there's not a great connection, especially we talked yesterday about minors. When you have these injuries with minors, there's not a good call from the nurse's office and the parent to the primary care physician to the teacher in the room who actually knows what's going on and can help them with this. So this is another thing, return to learn. So, okay, so now let's just really quick down and dirty review. How does that, knowing about how we manage concussions and the symptoms associated with it, tie into the endocannabinoid system and what we want to use? So this is part one. This would be the prevention part of it, right? If an individual is having migraines on a regular basis and that's affiliated with potential concussion or post-concussion symptoms, prophylactically, that's where we want to avoid any type of endocannabinoid deficiency. So, Josiah really talks about this well, and that is, in the way we explain this to individuals in our profession, because we really have to start at ground zero, is we ask them to think about diabetes. Everybody in here knows what diabetes is and how it works within the endocrine system. So what really happens with diabetes, an individual is unable to produce insulin, or they produce insulin and it doesn't bind to the receptors, so they have a whole lot of sugar in their blood, it doesn't get broken down, and they end up with these symptoms, right? And anybody we talk to in healthcare can easily understand this. So then we say, well, this is exactly what happens in the endocannabinoid system. Individuals supposed to naturally produce cannabinoids inside their body. And if they're not producing them, and or they're producing them but they're not binding, they end up with some symptoms on the end of it, right? It could be fibromyalgia, it could be migraines. It's arguably a lot of those things that we haven't treated well before because we've not really known what the cause was. And so this is what we tried to explain to them. Maybe, just maybe, number one, prophylactically, there can be individuals who have a deficiency, but they're 19, 20 years old, so we don't really know because we haven't identified these yet in their life. but when they have a concussion, that might be one of the first times you identify it. And so would there be a benefit to using natural cannabinoids, just like we do vitamins, if we think we have a deficiency in A or C or a multivitamin? So we're going to wait and see what happens in this area because we just don't have enough research for it. But we do know, and you all know, the affinity for the different cannabinoids and the receptors. And this is a part that we have to have people understand in healthcare to better realize why we want to do these studies. And this is a very specific, so when we study cannabinoids, you never know who's reviewing the work that we're proposing to do. They could be, they have nothing to do with athletics, but they're neuroscientists. And so we have to speak languages that they don't understand because we'll say, well, we want to study and see if CBD can help with these functions that occur in the brain. And they might come back to you and say, well, what part of the brain? Well, hell, I don't know. The brain. But you don't, we have disconnected individuals working with each other basically to pull this research off. And I don't harp on this, but this was the patent number, for those of you not familiar with. It's one of our key talking points is about who held the original patent. Another key talking point is how the .3 came about arbitrarily, things like that. But this is a key part. So we know that CBD has been identified by many as a neuroprotector. And relative to neuroprotection, then going back to the slide I showed you earlier, how will it help? I can tell you this, many of you might know this, but in other countries, they're looking at studying various types of auto diseases that lead to constant tremors, Parkinson's, MS, ALS, and they're identifying neuroprotective properties, which doesn't allow for that slowly progressive neurological disorder in these conditions, so people's symptoms don't necessarily get worse when they're using cannabinoids. And so this would be the goal here, is going back to what we showed you earlier, is to breaking up these components and allowing them to heal better. This was 2015, and this headache, for those of you who don't know, is actually a very reputable medical journal. And what you'll see here is they started recognizing already that there was a role for CBD here. And what I'll tell you is really important, is a lot of these folks that will come out, they'll use the word appear. If you see the word appear, like CBD appears to do this, and it's coming from a reputable source, what they're really saying is, shit, you're right, we just haven't figured this out yet. Because they know, they're aware of the N of ones, and they know that this exists, but are not willing to yet stick their neck out and make a position statement and stand by this. We saw this for decades in sports medicine area with knee braces, where patients were saying, I need the knee brace, I feel better. Nothing that we could do biomechanically in research studies ever showed the proof that the knee braces would work, but patients would swear by it. And swear by it might mean just gave them a little boost of confidence after an injury or something, which is fine if that's what they needed to play. And so you'll see the word appear. We think that knee braces appear to help patients. But appear is a good word. Sounds like gray, but I like it when I see it. It's the first step towards admittance. And so the other part of this that we're looking at right now is relative to the anxiety that comes along with this. But again, will there be a role? This would be more post-concussion relative to this. Because I think it was Jim talked about the dose response curve. So if I got up here and I had a small amount of THC, maybe it would help me relax and speak before an audience. But if I actually took a little bit more past what would be the optimal amount for me, can it do the opposite and increase my anxiety levels? And that's what the literature shows. But the problem is we don't know the exact dose, and the exact dose is going to be different for every single person. And so this is one of the concerns you would have down the road anyways. If we were trying to reduce anxiety with medication of cannabis-based, what is that optimal dose that's not going to make it worse for them post-concussion? And again, that's what it looks like. So on the left, you see a low dose, and you'll have a high benefit as you find that maximum ideal one in the middle, but when you start using too much, you get lower benefit. This is another thing that people are talking about when you return back to sport after the injury. You hear people say, well, I know you're going to be nervous and anxious, but when you get that first hit, then you'll be fine. Or when that player goes out in front of 110,000 people at the big house in Michigan, it doesn't matter how good they are, they're nervous. So is there a reason? I've talked to and worked with athletes who have smoked marijuana literally before game time for that reason. They said, I'm just too nervous, I'm too anxious, I just need to do this, I'll feel better when I go right on the court. And these are professional athletes. Just to bring to your attention what I was aware of in the past, I tried to research this prior to coming to this meeting and really found no updates or nothing new, but the University of Miami started studies in this area of concussion and cannabis years ago and partnered with a company out of Canada who actually gave them we'll say a generous sum of money to perform their studies. They initially started with animals and they found some good results. And they were progressing to further studies. I thought the last time I heard of this, which was a couple years ago, they were going to start being able to use human subjects here. But I haven't seen anything past what we call the clinical, preclinical pilot studies. And so if anyone's interested in just learning more about it, Dr. Hotz, who's at the University of Miami, was the lead investigator on this work, but I have not seen anything, not even in research and science publications, but just even, they had a lot of press on this when they first partnered, and I haven't seen any new updates on the press. So I'm curious to know whatever happened, because that's, if you want to give me that kind of money, I'll be happy to try a study with you as well. And so I'm gonna fly through that, but I mentioned to you what the things are that we want to decide about post-concussion and those symptoms. And I'm going to stop there. I know, is the 2:20 the end of my time or the end of all of our time? Okay, so we're plenty good on time here. So I'll stop there, and I will moderate, I guess, this session for the three of us. But does anybody have any questions for any of us about what we presented? Yeah, the microphone's right there.
Okay, so I have a question for the panel, so something that kind of came up in Dr. Farris's presentation was the increase in heart rate for one of those studies. And then Kevin, in your presentation, we talk about performance and recovery and both kind of mixing with professional sports. So in professional sports, players use Aura and Whoop bands to monitor heart rate variability as maybe a self way to monitor if they are recovering from maybe CBD use. So I was just wondering if you've seen any of that in your experiences with athletes, and then Dr. Farris, if you've seen anything in the research about heart rate variability and CBD use.
So the short answer is no. Yeah, Aura and Whoop, and there's all sorts of different apps and stuff that are measuring HRV, among other things. I think one comment that I will make on that is that I'm not sure heart rate variability is that easy to affect and to change. And so people like to run around and tell people how I'm 77% recovered, right? I think the recovery part of those technologies is pretty interesting. Not necessarily sure how they come up with that measurement. There's some fancy algorithm, I'm sure, but relative to HRV specifically, I'm not convinced. I'm not an expert in this space. I'm not convinced that you can change your HRV that significantly. Okay. So as much as on one hand I would love to see any type of data, whether it was anecdotal or otherwise, that would show any type of correlation between, after a game I took my CBD or used cannabis and then the next day my HRV was this or my recovery was this. I think it could potentially be, certainly would be interesting. Whether or not that's useful, I don't know. It certainly would be interesting. HRV probably isn't a measure that I would choose to look at, the more global like recovery index. A lot of teams or people in sports are using just surveys, and there's a lot of different survey delivery methods where you get a survey every morning that says, it's really basic, how rested do you feel? How well did you fall asleep? A little bit of it is like the lead sleep questionnaire, right? Like how well did you fall asleep? How well did you sleep? How was your fogginess on awakening and, your level of soreness 1 through 10 or whatever. And so, if we can measure recovery, I don't know that we can. If somebody does, please let me know. But, as we try to measure recovery, which I think is a lovely idea because we like to quantify everything, right? And so if we can measure recovery, the way how CBD, cannabinoids, cannabis affects that certainly would be very interesting, I think, to all of us.
Okay, yeah, that was just kind of where my thoughts were. When I saw that slide, I was like, man, how do we measure recovery objectively and maybe subjectively, and maybe leaning more subjectively, like you mentioned, could be the better route, so.
From the heart rate variability, some of the studies that I used were looking at the acute effects of smoking flower, the full marijuana. There was one other study, and so the heart rate was significantly elevated, as was systolic and diastolic blood pressure acutely afterwards. And then there was another study, although it was cross-sectional, so we have a chronic use group and a non-use group. And the chronic use group had higher heart rate and slightly higher, but significantly higher blood pressure than the non-use group at resting. So there's very few studies that actually do that and look at it, pre and post or down the line. But those were so you got acute effects that were pretty noticeable, and then the long-term effects were a little bit less, but again, cross-sectional, they were there.
Okay, thank you.
We good? There it is. Thank you guys for taking a little bit of a deeper dive. I appreciate that. One of the things that I took issue with a little bit is the claim that THC is ergolytic straight off the bat. I think we really don't have enough research to say that, and I do appreciate the running through the months backwards. But I think that may miss the point a bit too. Just this is kind of off topic, but I'm dyslexic. I have trouble with that normally. But when I go out and run, I can run down a icy, rocky trail, and I do so better with THC on board. And so, and there are a whole lot of athletes. You can tell them what the research says or the scant research says all day long, and they will turn around and say, it makes me better. It makes me more able to focus. So I think that, what athletes want is to confirm what they're experiencing or, refute it and explain why. And so that's one piece.
Can I stop you there real quick?
Yeah, totally.
Because I don't think any of us disagree with that, do we?
No, in fact, I was going to say I'm in agreement with you, but yet, looking through the literature, I can't help the athletes validate that. Right. And so, Dr. Konin and I were talking earlier that, we need a journal of marijuana case studies.
For sure.
Ends of 1, ends of 2, 3, 4 case series. Well, but yet, and it's not out there, so I don't know, maybe soon.
But by contrast to not whether I agree or disagree with counting the 12 months backwards, what I can tell you is it's a validated document that we used across disciplines to measure a baseline and then a change. Mm-hmm. So if you don't do that well, that's fine. We just have a baseline. If you don't do it well, if you then get concussed, we repeat it to see if you don't do it well, even worse.
Yeah.
You with me on that?
Yep, for sure. I got that. I guess, and the other piece was we don't have a lot of studies other than maybe Angela Bryan's on the long distance running, and I think if we did really evolve this, if Josiah's thesis and my thesis is correct, that we evolved as runners and we have this endocannabinoid system and this anandamide, which is more similar to THC than CBD is, what is that really doing in the body and what is it doing at mile 20, And I think the on-field, kind of athletic research doesn't quite get to that because they're accessing, they may not even be accessing it. They may be sprinting all day long, and they're not really falling into that flow necessarily.
So, that is one of the easiest studies that we could replicate in a lab tomorrow.
Right.
If someone gave me approval, I can take a runner, throw them on a treadmill, an uneven surface that moves, and test all of the parameters of them and answer the question of that instantaneously. And that's as lab-based as well as field practical as it comes, because that's how all the tests are done for the runners for the most part scientifically. So I agree with what you're saying, and I think that's exactly what we want to do, is to answer those questions and be part of contributing to that, if people untie our hands and take the handcuffs off.
Yeah, I think that's what we're all struggling with is the handcuffs. Thank you, guys.
Mm-hmm. Good questions. I think we're all saying the same thing, and the challenge is, though, see, Kevin can't operate and perform an intervention because he knows it does work without evidence to support that, because his liability insurance policy can't even cover the defense of one player at the NHL suing him. So you have to be able to justify why we're suggesting X and doing X as a treatment. But it really isn't just him, it's every one of us. Dr. Gordon mentioned it earlier, it's to do the right thing for the patient. And we, in our situations, need that evidence to demonstrate, or at least to stand up here and say the evidence doesn't exist to support that. I'm not saying people don't do it absent of that evidence, but that's the challenge that we have. That's the challenge most people in medicine will use, to say we don't have the evidence to do this yet.
I kind of want to just base off of what she was saying. I have the Whoop, the little Whoop app, and you can actually modify the journal that when it comes up every morning, it kind of asks you the questions like, do you feel recovered? And I actually added, if I took my CBD, I take CBD at night. And after logging it for about 1 or 2 months of continuous use of CBD, I actually got a little notification at the bottom that said that based on the last 30 days or 60 days, your deep sleep was better with CBD on the days that you use CBD. Like, so maybe, I don't know, maybe that's like the start of something, you know, of how we can test the recovery between CBD and, you know, ourselves.
Yeah, I mean, I think just, you know, as armchair, you know, scientists or couch quarter, you know, whatever, we, you know, if somebody says to me, well, I felt better today than I did the day before, then my first question is, well, what did you do differently from one day to the next, right? And so we have this, when we deal with like skin stuff and allergies and stuff all the time, like, well, what changed? Did you change your deodorant? Did you change your shampoo? Like, what did you change that's touching your skin that's going to give you this rash, right? And I work with a lot of, you know, fair complected Nordic people, and so it's really, really hard because their skin's really sensitive. And so likewise, with what you're describing, you're sleeping better and you're in a position where you're measuring that or quantifying that in some way. Well, what did you change? Now, I'll tell people, you know, today as compared to yesterday, better, worse, or the same. If it's the same, okay. If it's better, well, what did we do that made it better? If it's worse, what did we do that made it worse? And that we take that into the therapeutic environment where, you know, we're bigger, faster, stronger. 4 weeks is going to turn into 3 weeks, is going to turn into 2 weeks. And how can we only make it 1 week? Well, I don't really know. But what I know is that we want to find, you know, let pain and swelling be my guide. So therapeutically, I'm saying, okay, well, I'm really, really sore today. Well, what did I do yesterday therapeutically that made you more sore? Maybe we did too much. You don't always know what too much is until you've done too much. And so we're kind of, these are a couple different examples of really chasing the same thing we were describing, which really, quite frankly, is really intuitive. That makes a lot of sense. And so to follow that, you know, the challenge there is, and we're constructing some studies at FIU in this space, and the challenge is, well, ideally, we'd love for you to take away everything else. So, which is hard, right? And especially if you're studying with college kids and say, well, I want you to take this product that might have CBD in it and it might not, it might have THC in it and it might not. I want you to use, you know, no alcohol and no pain medication and no Advil and no Tylenol. And you tell that to 18 to 22-year-old kids and tell them to do it for a month, right? And see what your compliance is. So, but with what you're describing, and all that's important is how it affects you. And I think that's what we're learning clinically, is that it doesn't really matter if we can extrapolate that to a million other people, but it affected you. And like Caitlin was talking about how that changed her life. If that changes your life relative to your ability to parent or go to work or whatever, then it has a lot of utility. And so adding all those things together is really, really powerful.
You know, there's another, we haven't talked about this a whole lot other than the fact that in a future conference it would be something we really want to hit on. We group Kevin, he's only working with hockey players, and we group everyone else as athletes. But there's a difference when we talk about what are the benefits or what are the impairments in a football player whose, you know, average play is 3.2 seconds versus a long distance runner. They're used in different systems for different reasons. And so it's not just a one size fits all. It's not even a one size fits all when I'm talking about individuals on the same team that are of different sizes. If I take a 305-pound lineman who is 32% body fat, but an elite athlete, an NFL draftable, you know, how is his system going to respond as compared to the quarterback who's, you know, 170 and 6% body fat perhaps? There's going to be a difference in their systems, as well as Kevin said, the comorbidities. It's very difficult for us as well, even when we can do our studies, to simply come out and say statistically, which is the term we have to use, statistically significant, that yes, in fact, this was the reason that there was a change in the results, because it's very hard to control all the other variables in their lives.
I'm just going to respond to your statement a little bit. And I think that's where doing the research in what they call a natural environment versus the controlled environment is going to be a start. And I've heard rumors of about 3 universities that are going to be able to start doing those natural environment types of studies, similar in nature to the one Josiah described that he participated in, which I thought was actually very ingenious, about as control of a natural environment as you can get. And so studies like that of being creative as an investigator versus, trying to, keep in that super hyper-controlled environment, that's, I think, going to give us a good start and maybe break down the ice and chip away at that big barrier that we've been working through.
So we had one of our studies turned down just by doing that, Jim, creatively. They wouldn't let us do it in a certain location we had, and we couldn't get approval for them to do it, so we proposed a study. We'll do it in this public parking lot here. We'll set up a table, put some cones around it, and we'll do it there because nobody owns that. We thought that would be a neutral place, and they shot that study down on us. We had another study, you're talking about sleep. We were going to do a sleep study using CBN and Major League Soccer players. And this one actually got approved on our end, and then Major League Soccer reviewed it and said, no chance. There's a chance of THC coming up in a test. And we said, there's no chance. It's not in what we're using. We're using this substance here. Here's our COA, et cetera. But what happened in the past, they had a player test positive at a level that was not acceptable, and his excuse was, there's no way. They just told me it was CBD gummies. That's all they told me. So they don't even want us to do that because they've been down that road before. So the athletic population is difficult to study at an even higher level because, at least if you talk about the higher level athletes, well, they're not going to let us use them as specimens during their training or their games. And then you get into the younger athletes, which are certainly not our test pool. We haven't figured out how to really utilize them yet in this process. And so there's a lot to be done because even when we start to see these studies, the next translation, we went from mice to humans, and now we have to go from humans to athletes. It's a little different population to study. We good? All right, it's break time, and this is want to ask one more question? Sure, go ahead. Grab the microphone if you don't mind. And then we'll be around here, so we're taking an official break, but anybody has any questions, just grab us here.
It's my understanding that part of the problem in the industry is that everybody's different. You touched on it today, so you don't know how much dosage of whatever to start with. Is there any research or development on some testing that an individual could take that would give some sort of a baseline starting point that would be consistent?
There's only one.
All right.
Okay, good. If that's the next lecture, I won't say anything, but I've seen there's only one study that comes to mind that actually looked at differences in dosages. And there seems to be an inverted U type of response like Dr. Konin showed in his type of thing. Too little, no response, just right, good response, too much, poor response again. So kind of a Goldilocks and the Three Bears types of thing going on there.
So you all are in for a treat next session. Barry, you've been phenomenally behaved, and he's going to own this place shortly. Right? Those of you who know Dr. Gordon, he's a wealth of information, but you're in for a treat. And I just want to point one more thing out as questions arise, anything about drug testing. Mike, would you raise your hand? Mike Colello in the back of the room. He works with Aegis out of Nashville, and their specialty go-to is drug testing. And so any questions you have relative to that, he's a wealth of information as well without giving out company secrets. I think it's a fair way to say it. So we're going to officially take a break because we do need to do our exhibit love, and then questions for anyone else will stick around here.
Recording stopped.